Ms. Duncan, welcome to IB Talk Online, and thank you for the work you do with children and their families.
Thank you for having me, Ivy. It is my absolute pleasure to be here to talk with you today.
Thank you, thank you. So I understand you have been with Encourage Kids Foundation for 25 years and
Yes,
started as a volunteer. Can
yes,
you talk about your journey with the foundation?
sure. So, as you said, I started as a volunteer. I wanted to give back and to do something that would help children. And the foundation just seemed like the perfect place for that, for me to volunteer my time and to place my efforts. And so that is exactly what I did. I started volunteering, and I was volunteering for about 4 years when my job was my company was bought out by another company, and the only division that was left was in Dallas. So it would have required me to move to Dallas, Texas. And then I went to Dallas. I visited. It just wasn't my cup of tea. No offense to Dallas, but I love New York City. And so I decided to stay. And at that time, then I had some free time, and a young lady at the foundation was about to have a baby, and so they needed someone to work for 3 months. So it was a great opportunity for me to continue to look for a job and to help them for the 3 months that they needed. So fast forward 25 years later, and now I run the foundation. So I tell everyone all the time, you should volunteer and maybe there's a job in it for you.
Certainly, certainly. That's a very good story you shared there. And I love the fact that your vision includes the word resilience.
Yes.
Can you share how resilience manifests in your organization and on the lives of the people you serve?
I think that, when you talk about resilience, it is the not just the capacity to bounce back from a trauma or a challenge, but also the village that helps you get there. I think that being hospitalized, being sick, having a traumatic injury, however you intersect with a health challenge, can set you back. Whether it is you have to learn to walk again, or you have to recover from surgery. And resilience is that aspect where everyone helps you to give you the tools that you need to pull out that strength that allows you to move on and to rebound from what's happened.
Let us dive a little more into your mission to
Yes.
humanize healthcare for children and their families. What are some of your programs that drive this mission?
Well, I would say our main program that drives the mission is our pediatric hospital support program. What we do with that program is we go to hospitals all across the country and we talk to them about what they need specifically. No hospital is the same. No hospital population is the same. What a hospital in Manhattan may need is different from what a hospital in Chicago may need, depending on which population of children they treat. Many hospitals have specialties. Some are oncology specialists. Some are specialists simply in traumatic brain injuries and other types of trauma, like pediatric rehab facilities. And so their needs aren't going to be the same. So what we try to do is come in, have a conversation with the whole interdisciplinary team, doctors, nurses, child life specialists, etc., and say, what do you need that you're not going to be able to get from your insurance companies and things like that, that's going to help your children here heal and experience joy, and that helps them move along. And that could be music therapy, it could be art therapy, it could be having the entire pediatric floor painted with joyful, beautiful murals for the children to look at. But whatever it is, it's unique to that hospital, and what they've decided is really important for their particular pediatric population.
Mm-hmm. And how would you describe the impact on the kids, on the children themselves? Obviously, they're going through a very difficult time at an early age, But
Yeah.
then there we have organizations like yours that's out there to support them.
I think the effect is that they have the opportunity to have an enhanced experience while they're in the hospital.
Mhm.
Um, Doctors are there to heal, nurses are there to assist and be on the forefront of healing. Um, because that is the primary focus of their job, they don't necessarily have the time to sit and play with children. And play is the work of kids, and it's how they learn to manipulate and interact with their environment. So if we're coming in and we're bringing in something that's desperately needed, that helps them to play, that helps them to connect more to themselves in the hospital setting in a joyful way, and again, promoting that resilience, I think that is where you find a really, really increased impact in how a child can get better faster, have a even more enhanced experience than they have.
Okay, sounds good. And what about their families, the children, the families of the children? How is that interaction with them and the connection with the work that you do?
I think, families are, oftentimes really at the forefront of suffering, especially siblings. Siblings can often feel neglected. Their, mom or dad is at the hospital, excuse me, all the time, and they are ushered to the neighbor's house or grandmother's house or something like that. And so when there's an opportunity and we have, if we provide money for family resource centers, or for playrooms that allow siblings to come in and play and interact as well, I think that really helps the families. Family resource centers are great for moms and dads because those are places where they can go and they can learn about their child's disease. They can often interact with other parents and learn how to help their child get better and to understand what's happening with them.
That's certainly helpful. Let's talk a little bit more about the family resource centers. Is it located in the hospital or is okay. And
Yeah.
go ahead.
Yeah, those is family resource centers are always located inside of the hospital because, again, parents can't always leave. A lot of times they are in that hospital for 12, 14 hours a day, and then they rush home and try to change. And so you want to give them everything that you can right at their fingertips, and make sure that they don't have to travel far to have that. And that's what we try to assist the hospitals that need that particular resource in doing.
Now you have a lot of experience with this organization, decades of experience. As you're thinking about the future, what do you see? What do you hope for?
I always hope that the childhood illnesses that we see are eradicated. I hope that science catches up and eradicates these diseases, so that there at some point isn't a need for an Encourage Kids Foundation. That would be amazing. But until that time, what I hope for is that we can continue to be a perfect partner with our hospitals in helping them, no matter what comes along. And there's always going to be something new. There are new challenges every time you turn around. I mean, COVID has been a huge challenge for pediatric spaces. Children are now being vaccinated, and child life specialists are trying to help parents understand, here's how you talk to your child about the vaccine when they're getting the actual shot. Here's a great position for you to cradle them in so that they feel comfortable while it's happening. Mental health is another huge issue that is coming to the forefront. We're seeing so many children who, a horrible statistic is that the number one cause of death for youth age 10 to 20 is suicide. We really need to get on addressing our children's mental health issues. It is imperative that we save them from this mental health crisis. So, IB, there's always going to be work to do. And we always want to be at the forefront of helping to do that work.
You mentioned child life specialists. So, for people who are not familiar with the work of the child life specialists, can you speak to what they do and how you connect with them?
So, there's a lot of explanations for child life specialists. I mean, if I shorthanded, they are professionals who are educated in the psychosocial needs that children exhibit in the children need to have addressed in the hospital setting. They are all master or above level degreed people. Many of them have had experience in early childhood education, and they are absolutely necessary when children are hospitalized and trying to navigate through the intense emotional experience of being hospitalized. And the way we work with them is that from the beginning, we've always worked with Child Life very closely, going to their meetings, going to their conferences, listening very closely, making sure that they are at the table when we are talking to a hospital about what that hospital needs. Child Life must also be at that table to guide and direct what that hospital receives.
As we look towards the future, Thanksgiving and Giving Tuesday, which is a day of fundraising for foundations like yours.
Yes.
How can our audience connect with your organization?
They can connect in so many ways, IB. They can visit our website, which is encourage-kids.org. They can also visit our social media sites. Facebook, which is a great one. Facebook participates, obviously in a lot of Giving Tuesday fundraisers. So we will be right there, on our page raising funds for Giving Tuesday. And Instagram as well, which now allows you to fundraise. So I would say, choose wherever you feel most comfortable to come and interact with us and see the amazing work that we do.
Awesome. Any last words for us?
It's just been a joy to be able to come on and talk about Encourage Kids Foundation. I hope that everyone has a great Thanksgiving holiday, able to spend time with their family or their friends, or maybe they're at work that day. To all of our healthcare workers who will be at work on Thanksgiving, we love you and we support you. And that's it.
Miss Duncan, it has been such a pleasure speaking with you. Thank you so much for your time.
Thank you, Ivy.
And to our viewers, thank you very much for your time as well. This was an exclusive interview with Michele Hall Duncan, President and CEO of Encourage Kids Foundation, which has a powerful vision of a world where every child, regardless of the difficulty of his or her medical journey, experiences joy, hope, resilience, and healing. I hope to see you again. And don't forget to follow us on Facebook, Instagram, Twitter, and YouTube. Thank you very much. Thank you again, Ms. Hall. I hope to connect with you again sometime soon to learn more about your work.
Anytime. Thank you.
All right. Thank you.